Something else going on in September. It is Pediatric Cancer Awareness Month. Millions of kids are trying to beat various types of cancer. With advances every day in treatments, they have a better chance. Dr. Matthew Ramirez is here with Palm Beach Children's Hospital. He's well versed in some of those game changers. Let's start off with the good news. It's that childhood cancers are pretty rare, right?
Yes. So they're compared to adult cancers, there are only really 1% of the new diagnoses every year are in children. So pretty rare. Obviously devastating, but rare.
Oh, yeah. And what makes it so devastating? Is it just the maturity of the immune systems, or what's going on there?
One of the things that we find is because, unfortunately, sometimes kids can't tell you, oh, my back hurts, my leg hurts, you know, I feel upset stomach. By the time some parents will notice these signs or get them to a doctor or something like that, it'll sometimes be fairly advanced and maybe metastatic in different parts of the body.
Now, I'm sure it starts with some of those aches and pains that you were mentioning. What are those symptoms of in terms of common types of childhood cancer?
So unfortunately, there's no smoking gun. So it really has to be a little bit of maternal intuition. Something's just not right, especially since most kids should be healthy. If all of a sudden they're not, for some reason, they're not getting over the cold like they usually used to, or they're having aches and pains for no apparent reason, after a few days. Some of those little warning lights start going off in parents' heads. So it's one of those things that if there is anything that seems out of place for your child, then you should probably get it checked out.
Okay, and what are some of the most common childhood cancers that you see?
Sure. So the most common is acute lymphoblastic leukemia. And this, however, good news is that it's no longer the #1 killer, even though it's the most common. We're doing much better through research. Overall survival for that particular type of, for the most common type of leukemia is about 90% or above. Brain tumors are the second most common, and unfortunately there's lots of work to be done, especially needing a lot of research in that field to help raise those survivorship numbers.
Okay, how has treatment evolved over the years?
Sure. So unfortunately not as quick as we'd like. So in my lifetime, since about the 80s till now, really only about 5 new drugs have been specifically developed for childhood cancer. We're still playing around with drugs that were your mom, your dad's generation, even grandparents' generation. But with what we have, we're doing a lot of research, and we've been able to increase those numbers, those survivorship numbers over the years.
Yeah, always good to hear some good news, and it's always nice to take your health seriously. Thank you, doctor, for joining us. We're going to go ahead and toss it back to Britt.